The coronavirus pandemic forcing many doctors in harder hit areas to scramble for equipment. We now have 35 known infections here in the valley, and today we learned about the equipment in place locally. Let's get to Christian Colon live at McAllen Medical Center. Christian.
That's right. What medical officials say, they are ready, they have plans in place, and are equipped just in case there's a shortage of supplies, as well as a surge of patients coming inside of hospitals. We spoke to some McAllen officials who gave us the breakdown. The staff at McAllen Medical Center has been planning for about a month for worst case scenarios. As of now, they have not had any positive confirmed cases at the hospital.
The Valley need to understand is that hospitals are prepared for this kind of scenario. Obviously, this is an extraordinary scenario, but we have done all we can to get ready for this pandemic.
Doug Colburn is Chief Operating Officer at South Texas Health in McAllen. Part of the planning includes making sure there are enough beds in place for patients, like intensive care unit beds. Region-wide officials say there are 72 beds open. Inside McAllen Medical, there are 38. Other areas needed to help fighting the pandemic are negative pressure rooms.
Draws air into the room so that anything that is in that room with that patient, that air stays within that room. It doesn't circulate back out into the hallway.
Joanne Shannon says in McAllen Medical, there are about 11 pressure rooms. Region-wide officials say 56. These are highly encouraged by the CDC.
We have had to use our designated area, and we have managed those patients very well. And at this point in time, we're handling the influx of patients that we are seeing.
Then there are ventilators used to help a person breathe. Region-wide officials say there are 143 available. Here in McAllen Medical, about 60. Region officials say hospitals have also started keeping a close eye on supplies of personal protection equipment, like masks or gloves.
In the form of gloves, gowns, respirators, masks, or face shields. And we are constantly looking to acquire more of that equipment, but we've gone into a conservation mode where we're using as little as possible to still keep the patients and the staff safe, but to extend the use of our current supply as long as possible.
Shannon says if you follow the county orders and you stay at home, you won't be putting people at risk, and it's going to end up fixing the hospitals or helping the hospitals. In McAllen, Christian Colon, Channel 5 News at 6.